when handling the TIVATO 700, it was a good stability, and I tested it because it was possible to handle the micro just with one hand, with one grip. This often is the case when you have a sucker or important instrument in the other hand. You would like, even though it's not probably the regular way to do it, to move the micro, to switch the position with just one hand. And that's possible. And that's really useful in the clinical surgical practice. If you ask if the TIVATO 700 offers stability, I would definitely answer yes, it's a rock solid stability.
There's another feature which is pretty good, that on the right hand of the handle you can three-dimensionally steer the microscope backwards and frontwards and cranial and caudally, which is also not offered by the other microscope so far. According to the positioning of the microscope, it's a very easy and practical positioning, both for the OR nurses and the OR staff as well as for the surgeon. Once the microscope is in place, you can position it easily with one hand or two hands, three-dimensionally, over your surgical field. The stability and stiffness of the system feels extremely good and stable, which is important because as a surgeon you would like to avoid any micro vibrations which disturbs you as well from the surgical procedure itself. The reach of the microscope is extremely important because, for example, in lumbar decompression surgery, if you have to go for a crossover procedure, you have to be maximum flexible with a very long lever arm of the microscope.